Hello, my dear students. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for almost more than 25 years, students. I've worked from tutor to professor to head of the department to dean. I've seen it all. And I have also seen from very close the amount of stress my students go through while studying anatomy unless they have understood how to study it. I've seen them worrying themselves to bone about how to give theory exams, how to give vivas in anatomy. And that is why today I'm going to tell you how to attempt vivas in anatomy exam. There is a skill to it. Let's discuss that skill today. Okay? Right. The basic skill, of course, is prepare well for your viva. Always prepare for the viva. Don't think I can go through viva without actually bothering to study for it. You must study separately for vivas. Right. So now, you know you have exam in a couple of weeks. You have started your theory revision. Remember, in every theory, make time out to study the viva portion. For example, suppose you're doing inferior extremity. Then make time to study femur, hip bone, tibia parallelly. That way, you'll end up revising for your vivas as well. Vivas you usually do not give separate time for it. During your revisions, you also study for vivas. Now, when you think of studying for viva, be thorough in your approach. Get your marks distribution from the department. Many a times, if you've given a practical exam, maybe a prelim earlier, then you know the marks distribution, know how much marks is allocated to every subdivision in your viva. That changes your approach. Oh God, histology is carrying 20 marks. I must study for it. So, it changes your approach. Important to know distribution of marks. Right. So, revise for your exams. Revise, discuss with your friends, practice for your vivas well. Okay, the departments will put up revisions, go attend them. Don't think I'm going to sit at home and revise. You can't do it. Some things have to be done there in the department. Go to the department, repeatedly revise, discuss with your friends, practice, practice, practice. Finally, exams begin. Theory exam in anatomy is done. Your theory is over. You have had a good amount of rest. Get back into the game. Start studying for your viva the very next day. Now don't waste time relaxing too much. Okay? Do not take a long break. Get back to studying. Start studying for your vivas after your theory exams. Right. So how to study? What to study? Study soft parts, osteology, radiology, surface anatomy, histology identification, histology discussion, embryology models, problem-based questions, etc. All this comes under the headings of study. How to study for soft parts? Right, let's understand. See, for superior extremity, inferior extremity, identification is the key. You have dissected well. You do know a good amount about each of the muscles or blood vessels or nerves that are there. But the trick is to identify it correctly. So focus on identification in your revisions. Remember, examiner cannot go deep inside to ask you for some popliteus muscle. Not likely. They will ask you superficial muscles more often. For example, they will ask you gluteus maximus, sartorius, rectus femoris, gastrocnemius. Or in upper extremity, they may ask you deltoid, biceps, brachioradialis, pectoralis major. Superficial muscles, superficial nerves and vessels are what is expected of students. If you're doing very well, then only they go for deeper muscles. I'm telling you my experience. For organs, what is expected? Normal anatomical position is expected. So whenever you pick up an organ, just for example, suppose this is a kidney or some organ, automatically hold it in its normal anatomical position and tell the examiner, this is this organ, this is how it is placed in the body. Don't wait for the examiner to ask you, what is this? Kidney. Which side? Left side. This is not the way you give vivas. The more you talk, the less your examiner will talk. The less you talk, the more examiner will ask you questions. So keep on talking. This is the kidney of the left side. I know this because I see the structures at the hilum from anterior to posterior. Talk, talk, talk. More you talk, the less your examiner will talk. A very simple rule. Okay? Let the examiner ask you to pause and ask a question. Otherwise, you keep talking. Right. Osteology. Again, always identify and hold the bone in its normal anatomical position. For example, suppose a scapula is given to you. Okay? Then the examiners will say which bone? You will say scapula. Then they will say which side? Then you will look around. Then you will hold it. It is of this side. Come on. Why your bone that you have picked up should automatically go in its normal anatomical position. The examiner should not have to tell you that. Okay? So that is one thing. Now I'll just take you through a few common questions. For example, skull. Most commonly they'll ask you foramina. Okay? They'll ask you mandible as well. For every bone they will always ask you normal anatomical position. For vertebrae, see, there is a superior surface and inferior surface of vertebra. Sometimes we make mistake in that. Don't do it. 3 most commonly asked vertebrae, atlas, axis and L5. Prepare them separately. Ribs, they'll ask you to lift up the rib, side identify. Otherwise, first rib is the most commonly asked rib. Pelvis, usually 2 are kept, male and female. They will ask you to compare and tell the differences between male and female pelvis. Study for that separately. Sometimes examiners may ask you articulation. Articulate the humerus and the scapula. What is the one thing you should watch for? You should watch for side. Don't articulate the left side scapula with the right side humerus. It is as good as suicide. Don't do it. Be very careful, match the sides and then only articulate. Embryology. Revise the development. These are some of the commonly asked models. I'm not saying only these will be asked, but examiner also understands that embryology is a little challenging for students. So these are the commonly asked models. They can ask you others as well, but at least study these. Histology. Histology has 2 parts. Slide identification, which you must revise till you get it 100% right. Many of you have got digital images now. Use them to revise. And then know in advance whether you are expected to write 2 identification features as well. Prepare for those also. If you have to just identify, then just identify, practice. Slide discussions will need you to practice your drawing and labeling. Practice that. Run through theory. Know at least 10 lines about any slide. Okay? So that's histology division. See, if you know 10 lines, basically you've got 65 slides. You have to learn 650 slides. That's all. Okay? Right. So, radiology and surface marking. Study for it. Don't think radiology hai kya, I see the bones and identify. Not at all. Read through your books and understand, know the different names of different views of radiology. Prepare for it. This is your scoring table. You're going to score in radiology. Prepare for it. Problem-based learning, usually you've been preparing for this throughout the year. Last minute, it's important to go through some of the PBLs so that you are able to answer more comfortably. Now, tomorrow is your Viva. What should you do? Have faith in yourself. Stay consistent. Don't see what others are doing. Who cares? Okay? Focus. Don't worry about the days you lost not studying. Just think of what you're going to do today. Students, if you are liking this lecture, do like and subscribe to my channel. Now today is your Viva exam, practical exam. What will you do? You will have a bath. Very important. I'm sorry that I have to put this up on your PowerPoint, but you do have to have a bath. Many of you think that if I look all bedraggled and dirty, they will have pity on me that I have not had time to even brush my teeth. Yes, but you should have brushed your teeth because now the examiner is in deep pain because you have not brushed your teeth. So for God's sake, have a bath. Comb your hair, put clips in your hair, wear clean pressed apron, clean pressed clothes, wear shoes, not chappals, and definitely not slippers. Come like a professional. It's a professional exam you're giving. Don't come decked up, no jewelry. Don't wear too much makeup and scare the examiner. Okay, it's not fair on the examiner to do that, isn't it? Right. Eat your breakfast. See, you never know how long these continue. I have seen exams getting over at 5:30 and 6 in the evening. You don't even have breakfast and you come in. It affects your performance. Eat well, come comfortably. Think positive, work on your confidence now. Right. This is a screen that is giving you all the things that you should be carrying. Just take a screenshot. Remember to carry your journal because that is often an entry ticket for exams. Without journal, they may not allow you to give the exam at all. So bring that and please go through this. I won't read it out to you. During the Viva, now when you're going to the exam, okay, button up your apron, wear your gloves in advance when you're going for a soft part Viva. At the table, wear a confident, pleasant smile on your face. Don't go laughing, yet don't go trembling. Have a confident, calm look. Always wish your examiner. Respectfully give your Viva. While leaving, dispose your gloves in the right bin. Remember, examiner is watching. Put it in the right bin. You are expected to know the different bins and which bin a plastic or rubber glove should be going. Right. At other Viva tables, what should you do? Osteology, always hold the bone in the normal anatomical position. Histology, identify with confidence and consistency. Remember to write the right slide number. Here you make a mistake. If you don't know one slide, you sometimes don't write that number and you move to the next. All slide numbers now go wrong and you will lose marks. Be very careful while writing slide numbers. Draw and label your diagrams well. Take your time. Tell your examiner, I need 5 minutes more. I want to draw well. They will respect you for it. For embryology, identify the model and start talking. Don't go for small details of the model. See, examiners also from outside may not know every detail of the model present in your college, but they definitely know their embryology. So start describing that embryology and that development. Okay, one Viva went bad. What to do now? Are you going to be depressed? Not at all. Fight. Are you going to cry? Definitely not. Although tears are considered a weapon in Vivas by some, but examiners also understand the use of a weapon. They know the true weapon is knowledge. Of course, there have been students who have been wept their way through Vivas. I hope that student is not you. So one Viva has gone bad. Are you going to just give up? No. Look forward. Steady yourself. Take that another step forward now. Okay? If you've started a fire, it's in your hands to douse it. Okay, come on and fight. So, for radiology, what will you do? Look at the X-ray and don't begin to say, oh, I see clavicle, I see scap, I see sternum. What rubbish. Everybody can see clavicle and sternum from standard 7th. You don't have to go to MBBS for it. But you classify your X-ray. Is it a plain X-ray or a contrast X-ray? If it's a plain X-ray, you will say, I see the plain X-ray of the chest region showing the following structures. That can include sternum, ribs, clavicle. That must also include the heart and the lungs and the shadows of lungs. Okay? Be a professional. Don't be a kid in your Viva. If you're seeing a contrast X-ray, you're seeing a contrast medium has been used, then you will say, I see a X-ray of the abdominal region, show here, which is a contrast X-ray. It is called as ascending pyelogram. It is used to visualize the following structures. Okay? Be more professional in the way you present your knowledge. Right. Surface marking, remember to wipe out markings done by others before you and then you draw. Take measurements properly, don't hurry, don't be casual, examiners watching. Remember, use your common sense. If you don't know the organ and its placement in the body, You have dissected, right? You have common sense. Use it. It will take you a long way. Okay? Problem-based learning completely based on your own study and analytical ability. Exam is done. Are you going to run now? No. What are you going to do? You go to the coordinator. Ask them, have I done all my Vivas? Is there any table unattempted? It happens, isn't it? Then collect your journal. And then leave, run. Vivas done, students. Now enjoy. You're done with your theory. You're done with your Viva. Now is the time to pat yourself on the back for having solved or really having successfully passed through a really challenging time for students of such young age. Okay? Be kind to yourself. Celebrate this moment well. Students, if you enjoyed this lecture, do like and subscribe to my channel. Share your thoughts in the comment section. I really want to know whether these lectures are helping you in your studies of anatomy. A separate lecture has been put up about how to attempt theory exams in anatomy. The link is given in the description section. Do please go through that lecture as well. It will help you a lot. All the best, students, for your coming exams. Do well and then enjoy yourself. Congratulations on having hopefully completed your first year. Thank you. See you across the screen in some other video.